Hi and welcome to Plexus Ortho. My name is Dr. Kannan Kumar. I'm a hand and upper extremity surgeon at Bangalore, and I take care of all kinds of hand and upper extremity problems. So today we're going to discuss a very common problem called as dequerent tenosynovitis. Dequerent tenosynovitis is something that happens around your wrist, on the outer portion of your wrist, and it's a very common problem. I see about two or three of these patients every day in my OPD. So basically, it involves the first compartment, so the so-called first compartment of the thumb. That is, there are two tendons here which go up and lift up the thumb, and it is called the abductor pollicis longus and the extensor pollicis brevis. These two tendons get inflamed just around the wrist region. It's very common in women. It's very common in diabetes patients. It's very common in women who do repetitive work. It's very common in patients who lift babies. So therefore, it's very common in newborn mothers and grandmothers who keep repeatedly lifting their children. So this causes an excruciating pain at the level of the wrist on the outer aspect. Even turning key knobs, tying your sari and making your hair all becomes very painful. So how do we diagnose this? We diagnose this with what is known as a Finkelstein test. So you put the thumb into the palm and then you ulnar deviate, you deviate towards inwards, and this causes excruciating pain over this region, and this is called as Finkelstein test, and this is usually positive in dequerens tenosynovitis. This is the clinical diagnostic test for this condition. What is the radiological diagnosis? X-ray is of no use. We usually do not recommend radiographs unless we suspect something else like arthritis in the region or some other bony issue. What may help is doing an ultrasound. It also is user dependent. Ultrasound is user dependent, and therefore it's not commonly done in all centers. What else can be done is an MRI scan. MRI scan can give us definitive diagnosis, but most of the times even this MRI scan is not required. So don't be in a hurry to get an MRI scan for this condition. Okay. How do we treat this problem? We treat it in three. There are three-step process for treating this. The first, or the step ladder, the bottom of the step ladder is to first give hot water fomentation. Take a mug of warm water, soak your hand in it like this, and gently exercise 15 minutes twice a day, and gentle massage over this region with some kind of cream will help. Second, take some painkiller medication. These two form the first step. That is, the hot water fomentation plus some painkiller medication is done in the first step. If this fails, then the second thing that you should do is go meet your hand surgeon and get a steroid injection. A steroid injection can be given right here, and this solves the problem in 70 to 80% of patients. So I give this injection about 2 to 3 times a day, so that is how frequent this condition is. And most patients do very well. In another video, we can show how we give this injection, but about 70 to 80% of patients do really well with this injection. Now, if this fails, we repeat an injection after a month and see if that works. And even if that way fails, then we think about the surgical options. So it's a very small surgery under local anesthesia. We may make a small cut of about half an inch here, and then we release the fascia. And that is enough, and usually the results are spectacular and the patient gets immediate pain relief. And this is one of the few surgeries where I tell my patients that you're going to have 100% relief after you do this procedure. So in a nutshell, that is all about dequerent tenosynovitis. If you have any queries or questions, please get in touch with me. You can ask your queries in the comment section. I do check them and I can reply to them. Thank you very much. My name is Dr. Kannan Kumar. I'm a hand and upper extremity surgeon at Plexus Ortho. Thank you.